One of the South East's largest hospital trusts has launched an investigation after a patient died while waiting to be admitted to accident and emergency. Ambulance crews regularly have to wait more than the recommended 15 minutes to hand over patients at the Queen Elizabeth Queen Mother Hospital in Margate.
Well, earlier this month, an unofficial memo to ambulance staff in East Kent told them to fill in the correct paperwork before handing over patients to ensure it's not our fault if anything happens. The QEQM hospital has sent their condolences to the patient's family. Well, our health correspondent Mark Norman joins us now. And Mark, this is all about the time it takes for ambulance staff to hand over a patient to A&E.
And how often it happens. So ambulances, as you said, have 15 minutes to hand over the patient, another 15 minutes to get back on the road. But when hospitals are full, that simply doesn't happen, and paramedics are left caring for patients either in the back of ambulances or in rooms that may or may not be appropriate. This person died, and clearly some paramedics in East Kent felt that they needed to make sure they were filling out the forms properly. But really, this is a system-wide pressure, and that concerns some local politicians.
There's a lack of capacity inside hospitals, there's a lack of beds inside hospitals, and there's a lack of cash for both staff and for patients. So that means when you go to a hospital and you're expecting to get speedy treatment, which in fact you usually need, you're not getting it. When you don't get that treatment, that's when preventable deaths can occur.
And Mark, there is strong guidance about ambulance handover times.
The NHS have laid this out in the strongest possible terms to hospital trusts and the ambulance service. They say tolerating ambulance handover delays is tolerating significant risk of harm to patients. It leads to longer delays in diagnosis and treatment, for example, and of course means no ambulances if they're waiting at hospitals. They're not available out in the community. Interestingly, this winter things have actually got a little bit better in terms of handover times. Having said that, across England, the equivalent of 41,000 12-hour shifts are wasted by the ambulance service just sitting in queues outside hospitals.
Okay,
Clearly
Mark.
not acceptable.
Mark, thank you.